Welcome to the PRShealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about PRP injection therapy. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. PRP or platelet-rich plasma therapy is an almost new treatment that has been used for several problems in the body all over the world. As it is very controversial these days, in this video we are going to give you some information about different aspects of it, such as: how is it working? How is it created? What factors can affect its effectiveness? What conditions is it useful for? When it may not work? When and for what problems should you consider PRP injection? Today, we are going to be sharing with you the answers to all these questions. So, stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. How does PRP prepare? As we mentioned at the beginning of this video, PRP is an acronym for platelet-rich plasma. This substance has been drawn from your own blood, and then the doctors spin it very fast to separate blood into the different layers. This is because the blood has many different parts, and for PRP injection all these parts are not needed. So, by spinning it, they can draw what is needed for PRP injection, which is a little layer of plasma that has a concentration of your platelets in it. So, doctors take the layer of plasma of your blood that is full of your own platelets to inject it into the place of injury. How does platelet work? Platelet has the ability to secrete or release the element which causes the body to grow. Actually, platelets stimulate the healing process. They can enhance growth factors and healing procedure, which is done by collagen. Collagen is one of the main substances which make different types of tissues in the body, such as skin tissue, muscle tissue, and muscular skeletal structures like tendons. Platelets also have pro-inflammatory effects and anti-inflammatory substances which are a great helper for pain reduction. Therefore, PRP is useful for both pain management and structure healing, especially for the parts where the healing process has become slow or even stopped. Influential factors on working of PRP injection. There are many pieces of research that have shown that PRP injection is really helpful, but there are also studies that can prove it is not working that much. So, what is the truth behind these totally opposite opinions? The most important part of it is that it depends on patients themselves in the way how many platelets are in their blood, and the way their body responds to these platelets after injection. Another element that can influence PRP's effects on the body is the machines that have been used to spin the blood. There are several types of these machines, and they work differently. Some of them spin the blood just one time, and the others spin the blood twice. It has been proven by many studies that each one of these machines graces a PRP solution with a different concentration of platelets in it. Some doctors add special substances that allow platelets to release their bioactive components more actively and more readily. On the contrary, some doctors believe that there is no need to add anything. Besides, there are other factors in patients themselves that can influence PRP solutions. In a study, the same blood has been taken from the same patient, but the effect of its PRP injection was different just because it was injected on different days. This is because depending on what you eat or what you do, you can impact your platelets and the way they work. It is also very important that how many platelets are in your blood and how they function. Mental and physical stress. Interestingly, mental and physical stress can have a big effect on the function of your platelets. When we say mental stress, it does not mean that you should have massive stress. Even daily stress that you might not take seriously, such as the stress of having an important appointment and etc., will affect every part of your body and as well as the function of your platelets. By physical stress we mean the actions that might not be that extreme. It's just about exercise. So, be sure that you limit some actions and manage your thoughts some days before they want to draw your blood. Diet. Diet also is an important factor that is directly related to the PRP solution function. If you have a diet that is full of saturated fats and sugar, or you are always consuming simple carbohydrates, your PRP or platelets function will noticeably decrease. Alcohol, smoking, and caffeine are also detrimental to your platelets. Some medications which all of us may use daily, like anti-inflammatory, antihistamines, some antibiotics, and non-steroidal medication, have a negative effect on your PRP function. What conditions is PRP useful for? Studies have shown that PRP injection is useful for trochanteric pain syndrome, which is a pain around the lateral hip usually caused by gluteal tendinopathy. Osteoarthritis of the knee is also the other condition that has been proven to be positively affected by PRP injection. The reason is people who have osteoarthritis suffer from a condition in which the injuries to the cartilage will not heal. PRP will help to increase and restart the healing process in the cartilage and leads you to feel less pain. PRP should have been added to your treatment process because it cannot be helpful enough on its own. When it combines with other rehab processes, it will work amazingly and you will get better results. So, when you have tried at least 3 months of a proper rehabilitation process, and you are not making progress, or the pain does not change a little bit and still prevent you from many activities, then PRP will be something that you should consider as an additive treatment. Surely, you should discuss it with your doctor before you are doing it. Keep in mind that PRP may be really helpful, but it is not a magic fix, and still it needs to be used in combination with other rehab programs. Do you have more questions about PRP injections? Feel free to share them with us in the comments section below. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.